Uganda has made progress in implementing key malaria control measures, in particular, distribution of mosquito nets. However, despite the enthusiasm regarding the potential for the elimination of malaria, there is no convincing evidence that the burden of malaria has decreased in Uganda in the recent years.
Cases due to malaria in the previous financial year were 14,904,773. However, this has increased from the previous 10,483 cases, 412.
The major challenge to malaria control in Uganda, in spite of the high malaria transmission intensity, is still the inadequate healthcare resources, as the Minister for Health explains.
The percentage of resource allocation to the sector stood at 7.2, which is still way back to the target of 15%. So that means that the resource envelope allocation to the sector is still not adequate. However, we still continue to prioritize according to the needs of the people, according to the disease burden.
Despite the challenges, prospects for the control of malaria have improved, with attention now put on underlying issues within the sector.
If we work together on hygiene and sanitation, we should not be having diarrhea cases, which is reported in the sector report. If we prevent malaria, we should not be registering mortality because of malaria.
The greatest burden of malaria by far remains the heartland of Africa, characterized by large contagious areas of high transmission, low coverage of control interventions, and limited infrastructure to monitor disease. Raymond Tamale, NTV.